name's Sutton. This is Road to Recovery. Today, my special guest is Sara Rose from Health and Human Services. Hi, Sara.
Hi.
Can you tell us a little bit about yourself?
Sure. So I'm the Supervisory Therapist with Child and Adolescent Behavioral Health Services, and I oversee several programs the programs have to do with working with children and doing prevention and early intervention for teenagers who are having substance use concerns.
Okay, great. Now, you're the first person that I've had on the show to deal with this particular topic, so I'm going to ask you a lot because I want to learn, right?
That's great. Yes.
So, with the adolescents, and when we say adolescents, what ages are we talking about?
So adolescents, we're looking at typically about 13 to 18-year-olds.
Okay. Now, in Montgomery County, 13 to 18-year-olds, what are their perception of using, like, for instance, marijuana?
So it's interesting because especially over the last several years, a lot of states have changed the legal status of marijuana and cannabis.
Right.
In Maryland here now, there's medical cannabis that is legalized. And so a lot of times teenagers are perceiving that as it's safe, you know, that this is a substance that can be used as medicine, therefore there's nothing wrong with it.
Right. And then legalization in D.C., that's right across the border.
Yes.
I was at a fair and I was like blown away because there was police on the playground, but then people were smoking weed right there at the event, right? And
Yes.
it seemed very odd, right?
Yes, very different than, even 5 years ago, 10 years ago.
Exactly. So is there any data or what are some of the concerns that we should be looking at as parents, as teachers, and community? Should we just promote marijuana use, or are there any dangers that we should consider?
So overall, the past, let's say 5 years, the amount of use among adolescents for marijuana has stayed pretty steady, surprisingly. However, their perception of the harms of marijuana has been decreasing over time. So even though they're seeing it maybe as less harmful, there's not necessarily a huge increase in the numbers of teenagers who are using.
Yeah, I think I saw the same data. I looked at SAMHSA,
Yes.
and I think it said like, I think it was 2/3. Their data showed like 2/3 of that particular population perceived no risk or minimum risk with using marijuana. Now, are there any risks? I mean, what are the risks?
So one of the things, just kind of to step back a little bit, one of the difficulties in studying marijuana is the current federal legal status of cannabis. And because it is still classified as Schedule I federally, it makes it very difficult for researchers to study the substance,
Right.
particularly among teenagers. So, the evidence that we have, we know that it makes when people are using and then they drive a car, that increases the chances for crashes.
Okay.
It makes them less able to be attentive and responsive
Right.
while they're driving.
Okay.
We also know that when people are using cannabis when they are pregnant, that has some negative outcomes for the baby.
Okay.
Including low birth weight. And the interesting thing is, a lot of times people are beginning to, as people are seeing that marijuana is less harmful, that they're using marijuana as medication for morning sickness when they're
Oh,
when
is
they're
that
pregnant.
right?
So,
Oh, and
yes.
that's
we're seeing
dangerous.
very
yeah.
dangerous. So we're seeing an increase in babies and newborn babies who are testing positive for THC.
Oh, wow.
So.
And even alcohol, which is legal, that would be some of the legal and problems with accidents, and that's a legal item. But even though there are negative consequences in terms of you can get a record for DUI, you can kill someone, you can kill yourself, you can injure yourself. So even though it's legal, it's still a concern.
Doesn't make it as okay to
just
drive.
because it's legal, right?
Yes.
So so marijuana would be parallel in that sense of legalization.
Yes, and they're also saying too that when people are using a little bit of marijuana and a little bit of alcohol, that makes them even worse drivers than either one or the other.
Oh, is that right?
So that's particularly concerning.
And from your experience and data, is the marijuana any different from marijuana? When we say marijuana, are we talking about the marijuana from the 60s, or is it any?
Completely different. Yes. So, particularly with, how the legalization within states for medical and recreational use has really changed the entire kind of spectrum on how growers are growing marijuana, and there's a lot of very smart people who have perfected the art of growing marijuana to really enhance the amount of THC, which is the psychoactive ingredient in marijuana.
Right, so it's very powerful today.
Very potent. The marijuana of the 70s and 80s, we're looking at 3 to 4% THC, and now typical THC content is more around 20 to 30%.
Wow, it's a big increase.
Very, very different.
And I was at a briefing, and they found that even some of the drug cartels are putting fentanyl in marijuana, so that it has even more of an effect on the user. So even marijuana, which is not even an opiate, is being affected by the fentanyl epidemic.
All sorts of things that can, lots of risks and dangers. Yeah.
Now in Montgomery County, do we have an alcohol problem with the youth? Or how are youth doing with alcohol? Is that a big item or what?
Definitely. Alcohol is the most abused substance among teenagers. We have almost 3/4 of teenagers by the time they're in 12th grade who self-report the use of alcohol.
Wow.
So it's a big number, lots of people.
And what's the negative consequences of alcohol use for adolescents?
So with alcohol, when people are driving, again, unimpaired, then that can cause all sorts of problems. In Montgomery County, we've had, unfortunately, several fatalities of teenagers when they're driving under the influence. Also with alcohol, when people are drinking too much, then there is the risk of acute alcohol poisoning.
Oh, yes, yes. I know a lot of times that happens on college campuses with the funnel, because I was in Annapolis when we were working on the Good Samaritan law, and a gentleman said his son was at a really good school, and his first semester he died from alcohol poisoning with the funnel. It was like an initiation to a freshman, and he had a scholarship and everything, and he died, and everyone was scared because they didn't want to get put out of school. So nobody called 911.
That's so
horrible. So I'm glad we got Good Samaritan.
Yes.
Because that goes for opiates and alcohol, any kind of overdose you can call.
Exactly, which is so helpful. And just, when we go out and talk with students, we talk with them about the Good Samaritan law and how important it is if they're concerned about a friend that they, know that they can call 911 and get support for their friend.
Good, good. And that's a good segue. So you go into the schools, or you have like outreach, or how do you get the message out there about the harms of, substance use disorder, harms of...
Yes, so we, one of the programs that I supervise, we go out into the schools and talk with the administration and as well as the students and parents, anybody who will listen, about the dangers, the harms of adolescent substance use. There's really no safe amount. There's no studies that say it is okay for teenagers to use whatever particular substance it is. Their brains are still developing, and so use of substances is can interfere with the way that their brains are growing and developing.
Yeah, that's what I thought.
Yeah. So we'll go out and do presentations to communities and to high schools and PTA meetings. Really wherever people are interested, we're happy to be there and talk with them.
And how's the reception been with the students in the schools?
So the students tend to be a bit skeptical when we talk about risks and dangers of really any substance use. But from my clinical experience, I've been working in the treatment field for the last 10 years, and I've worked with a lot of young people who, because of their substance use, they've experienced a lot of negative consequences.
Right.
And when they're able to stop using and when they're taking a break from their use of substances, how much better things get.
Good.
So I've seen personally, success stories when teenagers are able to make some changes.
Are there any programs for that type of role model to go with you, or are there any like peers, young teenage peers that are using their stories as a vehicle to help others?
Yes, so there's actually several of the high schools have SAD chapters. So
SAD,
SAD
okay.
is Students Against Destructive Decisions.
Oh, okay.
And we find that a lot of times, youth are more willing to listen to their peers.
Right.
That when we as adults are talking with them, they kind of, roll their eyes and
Yeah,
think
you're
that we're
old, you don't know what
exaggerating.
you're talking about.
Yes.
Right.
But when they're hearing it from their peers and they're hearing about, the concerns and the dangers from somebody who has been there, done that, and they're young, then they're more open to it, that, okay, maybe this person really knows what they're talking about.
Right. Yeah, that's been my experience. Peers really have a better language. They have a language that the other peer can really relate to. With adults and adolescents, I'm sure it's the same thing, right?
Yes, definitely.
So what other services do you have?
Yes, so we also have a program called ASAP, which is Adolescent Substance Abuse Prevention Program. And this is a program where there's a person who is in recovery himself who will go into the schools and run small groups for teenagers who are interested. Either they're high risk or they're interested in learning some new coping skills and strategies.
Wow. Now, does the counselor in the school refer the person to the group, or how does the person know about it and get to go?
Yes, so there are, the schools that are participating, the counselors and the staff will talk with the students about, whoever's interested in hearing more information. And then they sign up. There's a couple of forms that they have to sign. And then we go out and talk with them and help them learn not only the risks and the dangers of substance use, but also healthy coping strategies.
Oh, good. Now, do you take, because I saw that great PowerPoint that you showed at the AODAC forum. Do you take any materials? Do you show them different items?
Yes. So we like to really make it interesting and have the students engage and
Right.
Have them try out new types of coping skills and strategies, and really we like to get them as involved as possible.
Good. Because usually interactive learning works better with kids.
Definitely.
Yeah, when they kind of fall asleep and they get bored so fast.
Yes, absolutely.
So you have to keep something. You have to keep a ball in the air, right?
Yes.
Yeah.
Yes.
So we're going to take a little break now, and when we come back, we'll pick up with some of the services that you offer in the schools. Because I think the last time I went into the schools, it was only in health classes that we talked about substance use disorders. And I think they're doing better now in terms of getting more information out there for the kids to learn about substance use disorders and mental health treatment also. Some kids, and as well as adults, are probably using weed and alcohol to medicate, self-medicate
Yes.
for some disorder that they may not be diagnosed yet.
Yes.
I'm sure
Yes.
that's happening in that population also.
Definitely.
So this is Road to Recovery. We're going to take a little break, and we'll be right back with Sara Rose. Hi, I'm James Sutton on Road to Recovery. I have my special guest, Sara Rose, with me today from HHS. So, Sara, you were telling us about some of the programs that were available in Montgomery County. So what are some of the other resources available to parents and community members that are interested in learning more about how drugs affect adolescents?
Yes. So, one of the programs that I supervise is called SASCA. And SASCA stands for Screening and Assessment Services for Children and Adolescents.
Okay.
And it's a county program where we have licensed clinicians who are doing screenings for youth with their parents. And they're talking about behavioral health screenings. So we have the clinicians who are really working with the family to understand what are the concerns that they're experiencing, whether that be mental health concerns, substance use disorder concerns, or a combination of both. After the screening, then the therapist will make referrals and recommendations for appropriate services that are going to be helpful for the child and the family.
So where does this take place? Is this like a person that's called you and said, I think my child has a substance use disorder problem, and then they come into your office and that's where the assessment takes place?
Yes, so we are located in Rockville, and any parent can, call us up and say, I'm worried about my child. I'm not sure what's going on, or if they suspect that their son or daughter is using substances, that they can schedule an appointment and bring their child in to meet with us. So this is a service that is provided for free.
Oh, great.
So this
Good
is
price.
It's a great deal. And it's something that, a lot of treatment providers are charging a whole lot of money for this assessment. So we will do it for free, and then we'll make the connection for them. And then we also provide follow-up case management, just to make sure that there's no barriers for the child to access the recommended treatment.
So that when you say barriers, you mean you would make sure they have insurance, or be able to get to the place, or what?
Exactly. So for insurance, we'll look at what kind of insurance do they have, and the providers, and match them up with providers that accept that insurance. Even if they don't have any insurance at all, we have some providers that we work with who are able to provide services for them as well.
Wow, that's great. Okay. And what are some of the agencies that you have that are really doing a good job with working with the youth?
We have a couple contracts with local providers. There's Suburban Treatment Center, which is in Rockville, and they provide level 1 treatment as well as education.
Okay.
They provide information for both the child and their family about the risks and the dangers of substances.
Okay. Is that attached to Suburban Hospital?
It is. It's in a different location than the main hospital's campus.
Okay, but it's part of the same organization?
Exactly.
Okay.
And then there's also Journeys for Kids, and they provide level 2 treatment, and which is intensive outpatient. So it's more intensive services than our traditional outpatient level of care.
Right. Yeah, I'm familiar with Journeys, the Maryland Treatment Centers.
Yes.
Right?
Yes.
And what about the landing? What is the landing?
Yes, so the landing is run by Family Services, which is part of Shepherd Pratt, and the landing is a recovery clubhouse for teenagers who are interested in maintaining their sobriety.
Oh, okay.
Yes, it's a great place for teenagers to hang out. They can go over to the landing after school. There's some wonderful staff who work there who understand addiction. They understand recovery. They can help them with homework. They do fun outings and trips, and they do some skills learning, and they really do a great program.
So that's very good, because a lot of people, adults that I run into, their socialization is limited because of their substance use. They begin to only hang with the people that are using, and they get away from the people that don't use. So to be able to have fun and socialize in a healthy environment is important, I'm sure.
Very important, especially for teenagers. It's like we were saying before that, teenagers tend to get bored, and it's important for them to learn a skill, become good at something, and how to have fun in a pro-social, healthy way that's not going to get them in trouble.
Right.
Yeah.
As a matter of fact, the last event that we had the Day of the Dead, the Halloween weekend, and some of the landing came, and it was a couple of young kids of Latin descent, right? Mm-hmm. They sang and did rap in Spanish.
Oh, nice.
So, the landing, they seem to be really, bonding, and it was very diverse, so they seem to be doing a great job. Evelyn Lopez, right?
Yes.
Yeah, we give a shout out for her.
Yes, Evelyn's wonderful. She really runs great programming.
Right.
Yeah.
So now, with the schools, are the schools doing a good job, or how are they really welcoming you with the opportunity to do some prevention? Because we spend a lot of money on treatment, but we spend like no money on prevention traditionally. You know, all across America, we usually are putting the fire out rather than preventing the fire.
Yeah, and prevention is very important,
It
and
is.
it's effective, and there are some great evidence-based programs for prevention. The schools are actually really jumping on board with some of these prevention
Oh, good.
efforts, which is wonderful. Life Skills is a program that's evidence-based, and that's one of the programs that the schools are really looking into
Life
starting to
skills?
incorporate. Yes.
Okay.
There's been a lot of studies that show that when teenagers have positive life skills and coping strategies, relaxation techniques that are effective,
Oh, okay.
that is really helpful in decreasing the likelihood that they're going to really get caught up in addiction.
So,
Yeah.
would meditation be part of that? Do they do meditation?
Yes, meditation and mindfulness, and
Then they
yes,
do
it's
that.
helpful. Some of the schools are really kind of jumping on board and teaching the students about more
That's
of
good.
mindfulness. It's
That's
wonderful.
good
Yes.
because I tried to take my daughter to my Tai Chi class, and she
Yes.
said it was too boring. It was just too slow for her. She was just wanted to be busy, right?
Go, go,
So
go.
Tai Chi was just a little too slow for her, right? So I'm glad that they're introducing meditation.
Yes. There's also a program called Arise and Flourish that
Oh,
goes
yeah.
into a whole lot of the different schools, and schools have been very open to having people in recovery come in and
Right.
share their story. with
Yeah, I
the
had
kids.
Joey on
Nice.
about 2 shows ago, right? So he talked about Arise and Flourish, and he told his story, right?
Good,
So I
good,
know,
yes.
and David Oliveira, I know he works with Arise and Flourish, and he works with us too. So I do know that that's a great program
It
going
is.
in the schools, right?
Yes, yes, yes. And then we have the opioid intervention team that we meet on a regular basis. I'm also part of the opioid intervention team prevention group too. So we work together with the prevention manager of Montgomery
Oh,
County.
good. I didn't know about that.
Yeah, and we are looking at developing strategies to reach out even more into the community and spread awareness about prevention efforts and connecting people with things that work to
Right.
help kids not go down that path.
Right. And I know some of the data showed that in this particular opiate epidemic, this time it started with oxys and pills, and then gradually moved into heroin. Not like the 60s. The 60s was heroin. There wasn't an oxy to the heroin.
Mm-hmm.
But a lot of these kids are finding these pills in their homes, in the medicine cabinets, and taking it to school and throwing it in a hat, and everybody just takes a pill, and then next thing you know, they can get addicted to opiates or some other pill. So I'm
Yeah.
glad to hear that you have an intervention in place.
Yes, and yeah, we have more and more young people are starting to experiment with prescription medications. Again, it's this perception that it's medicine; it's not going to hurt me.
Okay.
Meanwhile, things like oxys and Percocets and all sorts of different types of painkiller opioid medications are extremely harmful, and it's highly addictive, and we are seeing young people who are using pills and becoming addicted to them.
Yeah, I know. Well, I don't really know about the younger than 20, but at the Soul event this past year, most of those people that died, most of the kids, they were like in around the 25-year-old
Yes.
range. They really weren't that old.
Yes.
Maybe 10 years ago, most of the ODs looked like they were in their 40s. But it's
Exactly.
getting younger and younger and younger.
It is, and we find that really the population that uses substances the most and are unfortunately passing a lot from overdose are the young adults. The 18 to 25-year-olds.
Oh, is that right?
And there's a population that also is increasing their use of cannabis higher, more frequently than any other age group. So that's really why for teenagers we're looking at targeting the youth and teaching them prevention efforts, increasing their coping skills, increasing their life skills, so that, you know, when they're given the opportunity to experiment with substances, that they are fully aware of the risks and the dangers.
Okay, and let me ask you this, because as a clinician, you can explain the stages of change, because kids might not believe that marijuana or cigarettes, really cigarettes, we didn't even talk about vaping, is a gateway to a progression that they may not see coming,
Yes.
we're coming close to the end. We got a few minutes left, right? So you can tackle any part of that. So what
Sure.
about the progression? Is that real?
Yes, yes, and you know, there's some pieces that increase people's likelihood to develop an addiction. You know, but you know, genetics, first of all, you know,
Okay.
is about 50% of the determination if somebody's going to experience a substance use disorder or not. But you know, there's a few risk factors, but in general, yeah, the first stage of addiction is, you know, we call it fun. It's the fun stage. It's where teenagers are using a substance and they're not experiencing any problems. They think it's great. So especially when they're hearing only the risks and the dangers of substances and, you know, in a very just say no kind of way, the first time they use, they may think this is all lies, you know.
Right.
But it progresses from just fun to fun with problems, and then the last stage is just problems. So a lot of times, you know, people can either move very quickly through those stages, or it may take a while. But you know, if somebody has a predisposition to experience addiction, you know, eventually they do get to that stage where it's just problems, and there's not fun anymore.
Right, right. It's the same thing with the adults. So we covered a lot today. I'm going to have you back, because we're really coming to the end for real this time, right? So thanks again for coming today, and I learned a lot. Like I said, we will have you back.
Okay.
And unfortunately, we won't be able to show slides next time either, but we're going to keep practicing this way.
Okay.
So I'm James Sutton. Today my guest was Sara Rose, an expert on substance use disorder as it relates to adolescents. And as you heard, we're doing some great things in Montgomery County. She's doing some great things with her team in the schools. And that's really an improvement from the last time I was in the schools. It sounds like the schools are becoming more involved in prevention, and HHS is doing a great job under great leadership under Raymond, under
Yes.
Raymond Kroll. I'll
Yes.
give a shout out for Raymond. And so this has been Road to Recovery. Today we talked about substance use disorder as it relates to adolescents. And we'll see you on the road to recovery.